It's on.
Awesome. Thank you. Thank you so much. And thank you for joining us, everyone. Welcome to this capacity sharing workshop. We have titled it Meaningful Community Engagement and Involvement in Health Research. Before we begin, I would like to acknowledge the traditional custodians of the land that I am calling from, the Whadjuk Noongar people. I pay my respects to their elders, both those who are past, present, and emerging. And I also want to extend a warm welcome to all the tribes, all the cultures, all the communities that are represented here today. If I've not met you before, my name is Yakubu. I'm a research fellow at the George Institute for Global Health, and I don't know how much you know about the George Institute, but it is an independent medical research institute. We have offices in India, in the UK, Australia, and in China. And we partner with communities all over the world. We conduct high quality research aimed at tackling major barriers to health. And through our Ubuntu Initiative at the George Institute, we are committed to building meaningful collaborations and partnerships with African researchers, their institutions, and their communities. So if you have not already done so, please take a moment to introduce yourself in the chat. We will be using the chat as a way of just engaging with you. We also have the Mentimeter to just keep this interactive because we'll want this to be a two-way flow. So a little bit about this workshop. It really grew out of conversations we've been having with our partners at the South African Medical Research Council, specifically the strategic research initiatives there, and a shout out to our colleague Naresh and Bianca, who have been supporting us in partnership talks. Some of our conversations with our colleagues in the Hypertension in Africa research team at the Northwest University, and I'd like to shout out specifically to Lebo and her team, and specifically again mentioning the Faculty of Health Sciences, University of Pretoria, a specific shout out to Professor Mavis and Senethemba, who we have been learning a lot about the Ubuntu model. And a lot of the conversations has really captured that curiosity around how do we engage with communities when we do research. And of course, we've been asking them the same question. And we would like this to be an opportunity to share a bit about what we know from the George Institute's perspective about what we have been doing. But also we would like to learn from your context. How do you do community engagement and involvement? And I think it's very important that we situate this discourse within an African context, an African framing, but also, for those of us who live and work in Africa, what can we learn from other parts of the world as well? That's also important. So a bit about the agenda. We talked about it running for 2 hours, but we think we'll just keep it short and neat to about an hour and a half. It will be 3 broad sessions. The first session really looking at, what do we mean when we talk about communities? What do we mean when we talk about engaging with communities? So we would like to establish that foundation. And then we'll now look at a framework, that we use and our approach, because some of the things that we have been asked is, how do you do this? So part of what we'll be sharing is the approach that we've used. We'll be inviting reflections from an African context. Professor Mavis and Ethemba are both here to share their thoughts. But of course, we'll be inviting you to share your thoughts on the go, and then we'll wrap up. So we've got 2 facilitators apart from myself. I'll first of all introduce Dr. Deepika Saluja, who works with us at the George Institute. She holds a PhD in public health policy, and she works at the intersection of health and gender rights. So at the George Institute, Deepika does 2 things. She works on our Global Thought Leadership Program, and she's also the program manager for the Ubuntu Initiative. So welcome, Deepika. And then Maruf Khan will also be our resource person. In fact, Maruf is someone that you will like to listen to. He also is part of the impact and engagement team here at the George Institute, and is currently engaged in our community engagement and involvement as the manager of our NHR Global Health Research Center for non-communicable diseases and environmental change. And what Maruf does there is to oversee planning and execution of our community engagement and involvement initiatives in India, but he also supports, our coordination of community engagement and involvement in Bangladesh and in India, in Indonesia, and he works very closely with researchers, policymakers, and civil society organizations. And some of the things we've learned from Maruf is how he does his best to bring community voices, centering that, in the research that we do. So I really hope you enjoy the session, and the other thing that I'll mention is what we are hoping that we'll be able to do together. Is write about experiences, write about community engagement and involvement. So if this is of interest to you, please put your hands up or send us an email. We'll share an email together. So we really like to write about how we may want to do this, opportunities for doing this better in an African context. But the other thing we're hoping to do is also collate a compendium of what you are doing, some of the challenges and opportunities that you're experiencing. That's probably a much more longer term thing. But the immediate thing is, a commentary that captures our experiences and opportunities for doing this much more better. So with that, I will hand over to Deepika to lead us further.
Thanks.
Awesome. Thank you. Thank you so much. Sorry, Deepika, I missed this. And thank you so much for reminding me. So quickly about when we asked people what they wanted to see in community engagement and involvement here, what we found through these assessments was that a large chunk of people that replied to us had research experience, but very minimal number had a formal community engagement and involvement training, just about 20%. And just about 31% were using a structured approach. So we think that this is a good opportunity to share, a structured approach that we've been using, but we're also inviting reflections on what our partners have been using in the South African context and beyond. And some of the things that we have heard that you use are things like community mapping and prioritization exercises that you do with the community before the research starts, community case studies, and then, starting advisory boards before the project starts. You've told us key barriers, and I trust that, our resource persons will highlight, whether they experience this as key barriers as well and how they addressed it. Next slide, Deepika. And then I think part of what you've also told us is that not a thought of you, just about a thought, over a thought, use specific frameworks, in the way you do your community engagement and involvement. And there's a bit of that uncertainty around what a structured approach might look like. And so what we've heard is specific for supporting your learning and learning needs is really how do we understand community context and use local knowledge to frame the way we do community engagement and involvement. You've also expressed desire to know more about trust building and the way you have addressed co-design and cultural sensitivity. Power dynamics comes up in our discussions with community because of the uneven, field between researchers and people with lived experience. And then you've also said you also want to understand a bit more about accountability. Maybe some of this, not all, but we think a large chunk of this will come through in some of the things we share with you, and we'll invite you to share your reflections. We do have a case study to share with you, which addresses some of the things you have talked about in terms of your preferred learning. All right, I think on this, I'll hand over to you, Deepika, to take us forward. Thank you.
Thanks a lot, Jacobu, for providing that context and also just giving an overview of the needs assessment exercise that we did. Just to add to what Jacobu has shared, we did this exercise and we received a very promising response on this, around 41 responses, and based on that, the workshop has been conceptualized in order to address those needs that have been highlighted, primarily around structured way of thinking about community engagement with some practical examples. And we would really look forward to hearing from you. So this workshop is going to have some components through Mentimeter and other forms of engagement case studies. So we require you to fully engage with us so that it becomes an interesting learning experience for all of us. Beginning with the first section where, as Yakubu mentioned, that we would like to hear first and kind of set the foundation strong in terms of what do we mean by the terms when we say communities and meaningful engagement. And for that, I would like to request you to go to mentimeter.com or www.menti.com, and you can either scan the code from the screen, I hope you're able to see, and alternatively, you can also use the code 59488962. I'll take a minute. I see a few thumbs up coming. Great. If all of us have been able to log into it, Yakubu, if you could also just help with typing the code in the chat, that would be helpful. And the first question that we want to hear from you is, what do you mean by communities? Like, what comes to your mind when you use the term or think about communities? There is no really right or wrong answer. I mean, whatever comes to your mind, we would like to hear from you. What do you mean by communities? So please do not hesitate thinking about what should be the right answer.
Deepika Parul is saying in the chat that she has added a reply, but it is not showing. And Kavita is also saying the same. So I think people are adding, but it is not coming up for some reason.
Oh, okay. So you may need to switch the screens.
Yes, yeah. I'll just do that. Okay, I'm gonna share my full screen so that I can shuffle between the slides and the Menti. Sorry for this technical glitch. And
Yeah,
are
we
you
can see
able
your
to
slide now.
see?
Yeah.
Yes. Okay. Great. So fantastic. Groups who share common interests, shared interest, group of people, similarities, population, proximity, interesting about range that we are getting from consumers to beneficiaries to stakeholder groups, people in general, even research participants, people living together, people living together in a certain geography, there's connectedness, religion, society at large. Thank you so much for your responses. Perhaps we can go to the next slide, where if you're able to see the screen, please give me a thumbs up quickly. The next question we would want to hear from you is that what comes to your mind when you hear meaningful community engagement and involvement? Again, I see very interesting inputs. So I see respect, honest reflection, reciprocation, giving it back to the community, ownership, co-creation, relationship is at the center. How can we improve lives and bring change with engaging communities through shared decision making, trust, and connection coming repeatedly. So maybe at this point of time, what we can do is we would like to hear from you, open the floor and actually hear from you. If you would like to elaborate on the points, for example, when you say legitimate, how do you understand that? Or accountability captures calm sentiment. So could you please unmute yourself and or raise your hand? Um, and we would like to hear from you. Yakubu? Yakubu,
Yes,
you want to
yes,
go?
I'm happy to get us started. I was just reflecting on a conversation we were having with Maruf, where we're talking about communities, and traditionally we will think of communities as people who are co-located, like you share a geographic space. But I just thought about something else around, issues around shared interests, and that a sense of connection can even transcend geographic space. And that I can feel a sense of connection or experience a sense of connection with somebody who is not necessarily in the same geographic space as I am. And in that sense, I will have a sense of community, with people who we do not even share the same same geographic space at. but really keen on hearing what others think and how you've used community in your work.
Thank you so much, Yakubu. Anyone else who would like to share or add?
So
Sorry,
I would
I'm
like
trying
to add.
to. Okay, sorry, I was trying to put up my hand, but I can't find the hand gesture. If I can just share, I worked on a large survey, and we would have to, when we entered a community, we would have to go get the permission of the ward councillor, which is a political figure in the community. But very often, people didn't even know who the ward councillor was. So we'd be asking permission of someone who has no actual power. So then you're just sort of doing it for show. So I would think that meaningful community engagement is the opposite of that. Thank you.
Very interesting. Thank you so much, Rivka. I think I saw Anshuman speaking.
Yeah,
heard.
so I just just wanted to add on the community engagement involvement part where during my field visits and all based on some of my experiences, I can say that I felt that there are times when people feel that there can be something for example, there should be a two-way pathway between when a researcher is going and the community, because they should also feel that we are also involved in whatever project that has been designed for the benefit of that particular community, or are we our inputs are being heard and worked upon by them or not. So not an otherness, but a very, very we are same people, and then we are working for each other's upliftment or something like that. Not that, yeah, someone is a decision maker and I'm simply going to get the benefits, or there's no say in what is being decided upon. So more I felt it should be more, people should feel that something is done about them and they're also part of the decision making process.
Thank you so much. I think all these inputs in a way and reflections are pointing towards power dynamics between the researcher and the community members with whom we would like to work closely, and the other stakeholders or interest holders who come into the picture to facilitate or other bureaucratic structures that impact our way of engaging with the communities. Parul?
So in my opinion, when we talk about meaningful community engagement, we mean that we are truly working with the group that we are dealing with and not just working for them. And it's important for us to just listen to the ideas and involve them in whatever decision making that we are looking forward to, and making sure that everybody is like included, and someone who is like from a more vulnerable part is not left out. Yeah.
Thank you. Thank you. What does it really mean to be equitable when we think about working with communities and not for communities? Thank you for raising that. Maybe we can take one or two more reflections. I'm really interested in hearing the rationale behind the response where which says legitimate. If you're
And
comfortable
also,
sharing,
Deepika, there is someone has written not just for show. Really
yeah,
wanted to unpack that.
I think Rivka indicated towards that, but if that's not Rivka's response, yeah, it would be really good to hear. Yeah. No. Okay. Then Maruf, any quick reflections from your side? How do you read these inputs?
This is very interesting, especially on the previous slide where I could see that term people written in bold and how strongly it has come up. So it does shows that when we talk about community, it's about people. And then when we have people, there are connections that forms a society. And when you live in the society, so all the other terms that are actually mentioned in this slide, these are those connections, whether you are related to each other based on the geography, whether you are related to each other based on certain actions that you are taking together. You have some connections, you have different relations, and very happy to see the terms somewhere I read also fellow humans. So these each of these terms hold a lot of values, and I think everything which is here, it gives a very good shape or imagination that I could do based on this particular word cloud that I see on the screen. And I think by once we move forward, we will try to sort of like, because we are talking about three things here. One is the communities we work with, then community engagement and involvement, and then obviously what do we mean by meaningful community engagement, because every community engagement and involvement, not necessarily, and that's why I was asking that question, not just for show, because there is a strong debate which always goes between tokenistic and meaningful. So yeah, I'll pause here in case someone else wants to jump in. Otherwise we can proceed.
So just to add one of my experiences, I was going for this was my master's project, and I went for this mapping of paddy and everything. So that was going on. So when I was going for IDIs and FGDs and all, people were very excited that someone from government has come, and then they're going to take this whole thing to, because no one has visited from the government by the time in those villages. So they're very remote villages I was working in. So I had to be very clear that I'm not from government, and I'm simply doing this for my project. So nothing is going to go. But they'll also no, I'm not sure people were believing me or not, but they had a very different idea that this person is from the government. So I was not very much able to, I'm not very sure whether I was able to clear this perception or not. But yeah, I told them I'm not from government. I'm a student. I'm working on my master's project. So I hope I'm not very sure, it's still not very clear that what was the message that went, and whether by end of the interview and by end of the FGD, whether they were clear on the my purpose or not. So, yeah.
Very interesting observation. I think Yakubu wants to add.
Yeah, Maruf, I just noticed one thing there on the definition of community where someone wrote proximity, and just remembering something, I was listening to Shaya Bimbola talk about his book where proximity or distance can be both social and it can actually be geographic. And so, yeah, just reflecting on that, and I find the keyword proximity there quite
I mean, the
interesting.
debate that came up during COVID, people started calling it social distancing, and then someone flagged that could essentially be physical distancing, not social distancing. So
Interesting. Thank you
Anshuman,
so
I mean,
much.
you stay with that thought. We'll come back to it. It's a very good
Yes.
reflection, I would say.
Actually, Anshuman's reflection reminded me of my PhD data collection journey, because at that point of time, when we reach out to the communities at an individual level, particularly not associated or supported by an institutional or bigger project, and at that point of time, how we engage with the communities and what message are we giving through our engagement and the work. And sometimes in early stages, when we, for example, when I didn't have that much of exposure or understanding what hopes I am giving, it's very important to be mindful of that. So Anshuman's reflections kind of reminded me of that experience. Okay, Steve.
Hi. I've got a slightly different perspective on community. I tend to view I tend to think people often fetishize communities, that see communities as this common interest and a sort of benevolent force, and often, you know, that's true, but in many communities, what you often find are multiple interest groups, and they're not always aligned, and they're not always working, you know, together. And I think it's important to recognise that when we go to communities, it's who you're talking to may give you a different perspective from somebody else in the community who you're talking to, and that there are hierarchies within communities and the certain ways in which decisions are made. And if you go into a community thinking, well, we'll talk to the people that we think are important, because you potentially circumventing rules and hierarchies that are already existing. Is that meaningful community engagement, or are you being disrespectful to the way in which decisions are made in those communities? So I think it is a complex thing. I think people often treat community as the answer. Oh, we'll just let's ask the community, and then but asking the community opens up a whole lot of questions about who you ask, what interest groups you deal with, you know, and how you ask the questions as well. Yeah, sorry, I just wanted to sort of provide a perspective. Maybe it's a perspective that comes from an economist. I tend to see things more in terms of interests rather than so much as you know, sort of I
Thank you
don't
so
know,
much,
common good.
Dave. Yeah, no, thank you for sharing that very important question for us to reflect on. And I think we'll be touching upon it through the next stages. But quickly, Maruf, any?
No, it's a very interesting perspective. I mean, and one of the things that I will say on the onset, that I will first of all thank obviously you and Yakubu to bringing me so that I can learn with this group, and that is the reason that I never call myself as a specialist or expert in this area of community engagement, because you can never become one. You have to keep learning throughout, maybe because communities are evolving even faster than we are learning about things. So rightly pointed by Steve that there are characteristics, and these characteristics can bring cohesive groups together within the community, and then it may not. So you have to truly understand in your context what it means and the kind of work that you are trying to do.
All right. Being mindful of the time, I think we can move to the next slide. Over to you, Maruf.
Sure, thanks. So, like I said earlier, I mean, I was trying to curate some of the definitions which have been given by some popular institutes, organizations. And the two that you see currently on the screen bring in very different perspectives. So first one is from the WHO. And if you read through this definition, because it says a community is defined as a specific group of people who share a common value, common culture, values and norms, identity, interest, action, place, practice, or circumstance. So you will sort of relate to the first word cloud, that you have most of the things that were sitting in that word cloud written within this definition, which is written by the WHO. And then it does say towards the end that which is developed over a period of time and may be modified in the future. So like I said, that communities will also, they are evolving. They are not a static group of people, and sometimes they even tend to evolve much faster than we can even work, think, or write about it. And if you look at the second definition, which is given by the NHR, which is also the funder for our center, so they have tried to look at from a very some of you might think it from a very narrow perspective, which is trying it to narrow it down to those set of people with whom we are working and who will be affected by the research and its outcomes. So people like patients, community members in the community, their carers, families. You will have a lot of community leaders, elected representatives, a lot of organizations working in that area, religious or faith groups, a lot of commissioners, service commissioners, frontline functionaries, those sort of people. I won't say that definition on the top and one in the below is right or wrong. Both do have their own perspective. What I'm trying to bring in here is, and taking from what Steve is saying, that it is important for us to understand and define communities, what it means to the work that I am doing and what it means to me in my context, to ensure that there is no ambiguity in my mind or within our teams in terms of how we are defining community. So we are not contradicting on anything, which is not obviously that plain and simple. So if I give you another example, for the definition that we have created for our center as part of our center's CA strategy. So we took another step to even make it more simpler in terms that even if a layman just wants to, who doesn't understand anything about community or community engagement, wants to understand what do we mean by community, they at least get the sense, but only in our context. I won't say that this will apply in every given context. And we have kept it at the level that, as Yakubu said, that as part of the center, we work in Indonesia, Bangladesh, as well as in India. So we wanted to keep that opportunity open for our partners to further adapt it. If they think there is any particular contextual aspect of the work which is missing. So rather than labeling people just based on NCDs or something, if there is any local or cultural or any aspect which they can attach to it, then they should feel free to do that. And the reason that we have tried to define communities and then bring in the aspect of community ecosystem is because for a very long time we realized that people in our teams are using this term community interchangeably for a lot of multiple groups. And because that is happening, sometimes there were contradictions, there were ambiguity in the discussions that we were having. So to remove that sort of ambiguity, we thought, why not we first define what we mean by community, and then who we associate with if we talk about the community ecosystem. So to make it very clear for the teams who are working across 3 countries that who we are talking about when we say community members and when we say stakeholders or people who are the part of community ecosystem, because communities obviously are not the isolated group of people. So this is something that we learned from this definition. And even, I mean, now taking you through all these definitions, I think because there is increased emphasis on community collaboration, which indicates that need for consensus regarding the definition of community within public health. And in a way, you can say that there is no one formula fit for all approach that can be taken in this work. And that is why one of the challenge that people face is about defining communities. And if you are not able to do that on the onset, then when you actually move on to evaluate the contributions of community people in your work or achieving your objectives, so you will even further face more challenges into it. So any reflections at this particular point? Otherwise, we can proceed ahead. Now, coming to the next part, which I said about what do we understand from community engagement and involvement. Again, I've tried to bring in definitions from WHO and NIHR, where in this case, both the definitions are sort of similar in the way they have written, they've been written. So WHO says it is a process of developing relationships that enable stakeholders to work together to address health-related issues. And the objective is to promote well-being, positive health impact and outcomes. And NHR is saying again the same thing, that processes and practices by which individuals and groups within a community actively contribute to and influence the research process. And now they're talking about the partnership that forms between the researchers and the community members and stakeholders. So if you go back to that definition where we were talking about community members, and then who all they are there in the community ecosystem. So obviously research teams also become part of that ecosystem, and then this partnership has to exist if we want to further proceed on how we will do meaningful community engagement. And then moving to what do we mean by meaningful community engagement. So I came across this very nice, and I think it's also thought-provoking in itself, definition taken from Institute for Healthcare Improvement. And they have very nicely defined that meaningful engagement means thinking about community as a shared partner and a shared leader in this work. It means I am not moving forward without my partner's input and their blessing on whatever initiative we are working on together. I need to remember that I am not only expert just because I'm coming from academic medicine or a non-profit organization. Meaningful engagement means we understand that we have an opportunity to learn from communities. And then they went on saying that it is a bidirectional learning process. And it means that we are coming to table as equal partners. So all this, what they've written is very easy maybe to put together, but when you actually want to do all this and you go back to all those points that people were making in the reflections, that there are existing hierarchies, there is meaningful community engagement is always hindered by the power imbalances that might be very visible or sometimes even might not be that visible, that we have to identify and work with. But in these terms, and I think at some point, maybe later or sometime, I will also share a very interesting paper that was published by the National Institute of Health US, which is what is community and evidence-based definition for participatory public health. I think it's a good read. It again talks about all these things that I have been mentioning, and then also talking about why it is important to define communities with clarity, so that you are able to make sure that you're working to serve the communities. You are able to identify those important aspects of the communities that needs to be taken into consideration. Next slide. Okay, so I think I have given you enough food for thought to be asking a couple of questions. So who do you think is the expert in any research project? And again, there is no right or wrong answer. Feel free to write whatever comes to your mind first.
Hello, sorry, I can't see the option of raising my hand. Can I share who I think is an expert in any research project?
Sure.
According to my knowledge, I think the people we are conducting research with are the ones who remain experts, because we are coming as researchers to look for information from them. Yes, especially I'm seeing also this is supporting what I'm saying, the participants and the patients. Yes, I think they are the experts because we go to them looking for more information. Thank you.
Thanks, Nitin. Jacob?
Yeah, Maruf, maybe this is an unfair question, but just thinking out loud how we define expertise. And that also affects how I respond to this question.
Completely agree.
It's very interesting to see PI at the center being highlighted.
And for a short amount of, I mean, for few seconds, since I'm not a researcher and I'm always used to of reading PI in bolds, so I thought, why there is pi sitting in between of this word cloud? Okay, this is really, really interesting. And then I'm also, this is maybe something bringing a new perspective when someone has written lived experiences experts. So maybe Deepika, whenever you think we can move to the next question. Who is the biggest beneficiary of your research? And then there is hand raised from Glory. While people are responding, we can hear from Glory. Glory, you want to come in? You want to unmute and speak? You are on mute.
Okay, I was trying to unmute myself. I wanted to respond to the initial one, but with this one, maybe I can say some few words. Let me start with the initial question that you have raised. I was going to say both the researcher and the participant, particularly when you are dealing with the participatory research, because there you are functioning on equal partners. Your skill is going, or your knowledge, both the participants and the researcher, everything that you are going to do will culminate at something that is very appropriate, that will escalate you to the next level. So you don't have to see yourself as an expert alone, as a researcher. Thank you. And then the second one, maybe because I was not raising the hand for the second one, I think for the beneficiary of the research, obviously we have different stakeholders. After the research has been conducted, it can inform policymakers to change how things are done. It can also benefit the community a lot in terms of the dynamics that they are facing. Thank you.
Thanks, Glory. I mean, so if I give my opinion on this, for me, I sort of not prefer using the term expert, but it's more about experiences people hold, and people have different experiences. I think everyone's experience is important, be it based on your academic knowledge or your lived experience. So in those terms, there is experience that sits within the research teams or with researchers, and then at the same time that sits with the community members, stakeholders. So everyone brings in different perspective and experiences. So in that way, the simple answer for this question, that who is the expert, there is no one who can be called as experts. As we have said, that if you are talking about meaningful engagement, it's partnerships that are forming between different groups of people who are coming together to solve a common problem, ensuring that everyone's voices is given equal amount of importance. And sort of slightly want to challenge what we were seeing on the screen in terms of who is the biggest beneficiary. Deepika, you can go to the slide. I'll just quickly wrap this up. So who is the biggest beneficiary? So I mean, if you ask me, and this is totally my uh, opinion, you feel free to challenge it. But I would like to challenge all those who are saying that for the biggest beneficiary is a community member or communities or um, all the people who forms that part of a community, because typically it's the researchers who benefits the most of any given research project that they are working on, because you end up publishing papers. It brings a lot of credibility to the work you are doing. I don't know how much we are able to give that credibility to the community. And so we really need to challenge ourselves to serve the communities we work with, and also need to accept that we have certain privileges as a researcher that we hold. And we should use these privileges to sort of ensure that we are improving the lives of the people that we are working with. The idea of meaningful engagement is to have that humility to accept that we have those privileges, and then have ambition to do more for the benefit of the end users or community members for whom we are working. So yes, and now coming to the question why we think, I mean, as an organization, I could say, or even any part of our work, why we thought that CEI is important. So, I mean, it is very important because if you have this commitment of improving the quality of the research that you are doing, to make it more relevant, to make it responsive, translatable, like and accountable to our community stakeholders. So for us, it is most important to ensure that end users have a right to have a say in what is researched and how it is being researched. And then we must also acknowledge that this engagement brings a lot of benefits for our research teams, because we will get different perspectives from the communities. You will have sense of ownerships towards the research findings, and community will, and not just community, everyone in the community system will have more buy-in if you do that as a part of the process of your work. Next slide. Now, this brings me to then, if I recall some of the things that Yakubu highlighted, why do we need a structured approach to doing CEI? And obviously, one simple answer is that if you want to do meaningful CEI, you actually need a structured approach to do it, to ensure, because it is very easy to do some sort of engagement and then call it meaningful engagement. And there are different stages of research that you do, or the work that you do, but it has to be very, I mean, you have to be very clear in your mind. You have to hold. So talking about the CA framework that TGI has put together, the vision there, it was about that communities are being engaged in a meaningful manner. The practices or the processes that are done, they are consistent and sustainable in nature. And then at the same time, we are able to co-produce research with communities to drive that health equity that we talk about every now and then. And to make this happen, Deepika, next slide, please. One of the important thing, and this I think might not be very new, you might have seen a lot of frameworks in the past, and every framework will have some sort of either a level of engagement thing, engagement continuum, or some authors also give it a term of ladder of inference or ladder of engagement. But the important part to understand this level of engagement is that I find ladder term very interesting, because then you think about taking those steps from down to the top. because your idea is that you want to start with informing, but then you want the whole thing to take the shape of where it becomes community led. And in those aspect, it becomes very important for us as researchers to understand that whether we are able to give this shape. Because when I say inform, it is a stage where researchers provide information to build an awareness, and we may seek feedback at the end of the project, but then it is not truly bi-directional in nature. And then when we move to consult, we sort of start taking feedback more frequently, and then we reach to advice, where we have we talk about how active community engagement, community involvement, and measurable contribution to informing research is happening through respectful conversations. And then when we start bringing community into some sort of partner, where community representatives actively engage or actively work with researchers and or research organizations to collaborate or in for shaping the decisions that are being taken. But you can only call it totally community led when community is able to lead the research process by identifying the priorities on which they want to work on, where they're able to devise these strategies, where they're able to develop the objectives of the research that is being done. And then researchers provide expertise in terms of the research design, in terms of the process, in terms of the management of the whole thing. So basically, all the groups who are coming together as partners, they are using their experiences to the best level to work on a common goal. And it again also helps us in terms of when you go to the question of that, how you will evaluate that how well you were able to engage communities. So I find this level of engagement very useful in those terms, when you had to sit back with your teams and reflect how much justice you are able to do with this, because you can simply look at your activities and see whether you were able to move from informed towards community led. And if you have not, so maybe you might not be able to call that whole process or whole approach that you have taken that meaningful in nature. And next slide, please, Deepika. And then all these has to be achieved by upholding the principles of community engagement and involvement very close. These are the 6 principles that have been identified as part of the framework that is prepared by the TGI. These, I won't say that these are exhaustive or these are the only set of principles. You will find different set of principles in slightly different, not totally different, in different frameworks. But the idea is basically to understand these principles in their entirety, what actually we mean by respect and acknowledgement, and what it takes to actually ground these principles or upholding these principles closely when you talk about the work that you do with the communities. Like if I try to give a generic example of respect and acknowledgement. So as per the framework, it says that we treat individuals and communities with respect. We acknowledge their expertise. We acknowledge their time that they are contributing. We acknowledge the diverse perspectives which they share to shape the unique experiences and backgrounds. And we view communities as partners and agents of change, not passive recipients, subjects, or respondents. And you must have heard this common phrase which people use very often, and a very strong phrase in itself, which says nothing about us without us. And that's why it is important to uphold these principles closely, and it should reflect in your practice. Similarly, if I talk about trust and transparency, so we make sure that we are taking communities into trust and confidence in our research. We make sure in the next principle that we create a safe environment, supportive environment, which doesn't have any imbalances and biases, um, uh, in terms of the cultural safety. And then this has been the most talked about and very important principle of reflexivity and ethical conduct, because we have said under this principle that we will engage in self-reflection to increase awareness of our own biases and positionalities as researchers and team members. This includes acknowledging how we learn from communities during CEI endeavors and striving to foster more equitable collaborations. So we uphold all the ethical standards and aspects of engagement and protecting the rights of the communities we work with for their well-being. And then obviously the idea of sustaining and then reciprocity and iterative engagement, because we have to have a very pragmatic approach in the kind of work we are doing, and we have to make sure that we are evolving in the response to the changing needs of the community. And then I mean, it may involve deviating from the original protocol, so we have that flexibility built in our work, that we don't say that we just stick to this because it is being written in the protocol, and we cannot have that sort of flexibility because we have already written it. It has to be like this, no matter what perspective community is bringing into it. And with this, I will pause for a 5 minutes or so. We have a video which gives you a very good example of how, I mean, in a way, it will try to give you examples of all the principles you have seen in the work that is being laid out. And this video is from our Indonesia CEI team, and how it was done in such a structured manner. So maybe we go through the video first, and then we will come back to discuss more and maybe take
is the world's
questions from all of you.
Indonesia is the world's second largest plastic polluter, and this problem is serious in places like Malang in East Java, where communities often openly burn plastic. Plastics in land and water can harm ecosystems. Plastic burning releases toxins and microplastics in the air, posing significant risks to our health. Local governments and communities often struggle to manage plastic waste due to weak policy implementation, poor monitoring, lack of public awareness, and limited community involvement in developing solutions. Policies are rarely tailored to local needs, leading to low compliance. A sustainable plastic waste management system needs collaboration from all stakeholders, and the key to making this happen is co-creation. Guided by the Medical Research Council framework for complex interventions and existing co-creation models, we designed a tailored co-creation process to develop a context-specific multi-sectoral intervention. This consists of 3 key stages: planning, developing, and evaluation. In the planning stage, we developed an understanding of our context and built partnerships with community members through interactive activities such as circular conversations and photo voice sessions. We then formed co-creator groups consisting of community representatives, government officials, environmental activists, and researchers, all working together with a shared commitment to solving the waste problem. During co-creation stage, we at first co-developed a theory of change to ensure we have a shared understanding of our ambitions and possible solutions. In the next round, we shortlisted 11 potential intervention components using impact effort matrix. We then assessed the appropriateness and feasibility of the shortlisted intervention components with the co-creator group to finalise top 3. Our final intervention components include 3 main activities. Activity 1, establishing village regulations for managing plastic waste. As a crucial first step, we are engaging with families, community groups and village leaders to establish plastic waste management regulations to define collective responsibilities. By tailoring these regulations to each village's unique context, we aim to achieve effective and sustainable solutions through awareness campaigns, penalties for non-compliance, and rewards for good practices. Activity 2, setting up waste management facilities in the neighbourhood and village, neighbourhood waste banks or waste bank cells, small local waste collection centres. Residents can temporarily store their separated waste and weight and track recyclables. Waste bank managers will educate communities about recycling and foster community involvement by offering locally agreed rewards. Village waste bank units. These larger central facilities receive waste from neighbourhood waste banks and individual households. They will further sort and prepare recyclables for sale, manage finances, and pay for the collected waste, potentially creating jobs and income for the village. Activity 3. Provide training to community members and environmental cadres about the dangers of burning plastic and waste sorting. Our bespoke training will create new opportunities in the community to work as community environment champions. 10 champions in each village will be recruited and trained to effectively run waste banks and educate community members. These champions will raise awareness, monitor burning, organise neighbourhood cleanups and guide waste disposal, especially using waste banks. To ensure that our intervention brings dual benefit to health and the environment, we are evaluating the intervention and implementation strategy through a planetary health lens by bringing together planetary health experts, environmental activists, and academic experts. Finally, we evaluated our co-creation process to improve future co-creation efforts. Following the Research Quality Plus for co-production framework, we conducted focus group discussion and interviews to assess research quality, stakeholder legitimacy, and contextual relevance. Community members gave overwhelmingly positive feedback, valuing the inclusive process. Many shared that this was their first opportunity to be involved in decision-making at such a level. This is care. Let's care for our environment with care.
Thanks, Deepika. So any reflections, thoughts, reactions to the video or what I've said before the video? Yakubu, please.
Yeah, thanks, Maruf. And it's quite an impressive walk you're leading through the NHR Center. A few things stood out for me when, sort of reading through or rather listening. And I wanted to invite you to also perhaps summarize some of the other points that you wanted us to get from there. But one of the things that I realized there was, the approaches or the intentionality around planning. And I'm keen on understanding a bit more around what has helped you to plan. I see Steve needs to leave. Thank you so much, Steve. And then I see the other second was really around co-creation and development and how you've evaluated that. Are you able to just walk us very quickly, just mention those key stages again, just for the benefit of those of us who didn't grab everything and it sort of went by quickly? Yeah.
Sure. Any other reactions, reflections? I mean, feel free even if you just want to say that you didn't like anything in that video.
Hello. I just want to reflect on the video and say I like how the project or the research is going to lead to sustainable environment for the community, since they are doing the project themselves. They are mostly involved in their hands-on. I think it will promote sustainability from what I'm seeing. It's a nice project. I wish we could also adapt it in my setting, because we are having also areas where we are struggling with plastics waste, which is polluting the environment. Thank you.
Thanks, Nitimba. Anyone else would like to come in, or feel free to put your thoughts in the chat if you like.
I would like to, hi everyone. I would like to say what I liked especially about the video is that there was a review of the process, the co-creation process, if it went well or did not go well. And that is a process that I'm going through at the moment, doing a community engaged research for the first time. And I'm already realizing that the co-creation plan was not well developed or really suited for context. But I know that I'm going to improve the process. The team is going to improve the process at the end of this project, so that when we do it again next time or we collaborate with others, we can know what are the things to look out for and how we can continue to improve the process. So I do like the idea that we can always review and improve for next time. Thank you.
Thanks. Very important aspect of the work. Anyone else?
So just to add, what I felt like, because here what I felt like, that there was a lot of back and forth, and also inputs and expertise, and not just expertise, knowledge, going for back and forth between both the researchers and the community. Because when you're designing something at this level where it's going to come for co-creation, people need to know that what actually the problem is, not just from the experiences that are coming from the ground, but also academically or research through research. For example, this also impacts climate change and all. So as a global level also there are impacts. So what exactly is going to be impact on health or climate or other things, because there are many hidden consequences of what is happening. So again, I felt like that requires a good interaction between both from the ground and from the research community.
Yes, Anshuman rightly said. So maybe if there are no particular reflections at this moment, feel free to keep posting it in the chat. But let me try to give some more context to the video, because I understand like Yakubu said, that maybe it is a lot for you to absorb in a 5-minute video. Because this work that was captured in 5 minutes, it actually happened over a period of 2.5 years. And the initial video was much longer, but then we wanted it to be more presentable and we concised it to 5 minutes. And very important point which was made by Rifka in the chat, that how do we move projects being truly community led when funders set the research agenda. So first of all, I mean, the video, since it's a video and we try to make videos in a way that they're interactive, they send out a strong message about the work, and mostly end up showing a positive picture of the work that has happened. But then to give you the real picture of the background, the team that was working on it, it was not an easy piece of work, because in Indonesian context, plastic means totally different what it means in India, because in Indonesia there are a lot of livelihood activities that happens around plastic, and it holds a particular value. There are a lot of families who are dependent on segregating plastic waste and selling it to different vendors. So it's not an easy topic. It's a political topic. It's a political topic related to livelihoods, which you can start talking. So when our teams started going to the communities, there were problems in some of the communities where people were not feeling very good about this sort of engagement. They were sort of worried whether you are trying to just stop this plastic thing, and where do will I from where I will get my livelihood. In certain cases, I remember one of the instances where our teams went to meet a village leader, and the village leader said to our team that I am no one to give you the permission to do this work in my village. You have to knock every single door in this village, and if this community agrees, then I agree. If they don't, even if single village member is not on consensus, then you cannot. So they have to sort of explain that work in the terms that community understands, not in scientific terms, and then having that buy-in from the very beginning. And this brings me to the question where Yakubu was asking what was how it was planned and what were the different stages that were involved. So there was a very detailed planning phase that we had as part of this work. In the planning phase, we obviously identified the areas in which we wanted to work. And then as part of planning, we also started identifying stakeholders that we need to bring in as part of whose buy-in is very important to do this work from the very beginning. So as part of planning, we identified the locations, we identify and created a long list of stakeholders that we wanted to engage. We then also identified some of the CI activities that we wanted to do with the community. And at the same time, as part of the formative phase, we started doing some data collection, which was strategically done with the help of data enumerators, which were identified from within the communities, and they were trained to do this exercise. So there is no sort of backlash or any sort of pushback from the community if they see a lot of outsiders coming in and then asking for a lot of the data. And once we are able to plan all these activities, then our field teams first they started to do activities which were focused more on building trust, building those relationships that are needed within the community. Because I think without having those sort of relationships, it's very difficult to just assume that community will end up trusting you. I mean, trust is not which is just given. You have to gain that trust with the community. And once they had that trust, they also realized that there is some capacity strengthening which is also needed for the communities to understand what we are trying to do to contribute to this process. And the point that Sianda has made in the chat that communities might not always lead 100% of the project, but then one of the focus areas that we had is to capacitate them in the way that they feel confident enough to contribute this process. Because if you don't do that, if you fail to do that part, and sometimes we say that communities are not capable enough, but it is, again, it falls on us to bring them on board. It's the work that we are proposing to do, so we should not accept that they have this sort of experience from the past and they should just immediately start contributing and start playing a role of a leader. Or maybe if they don't want to play the role of the leader, they will agree to that we have limited knowledge. Maybe you give us more knowledge, more understanding of the work, so that we will be at par with you. And then obviously what I have said earlier and what I've shown in the definition of NHR, that it truly then paints that picture of partnership that emerged between the researchers, between the communities and stakeholders. So as a next step, then we started forming these co-creation groups. Within these co-creation groups, your recruitment criteria is a very important thing, that who you are recruiting and who you are not recruiting. So we very critically defined first who is our vulnerable population that we are identifying. So I think the Indonesian team was focusing more on the people who are affected by COPD, which is the population who is above 40. And then obviously pregnant women and children as well. And after identifying this group, then they sort of went on to prepare that list, that multi-stakeholder from diverse backgrounds who could be part of this co-creation group. And once we were able to do that, then we sort of thought that let's now put together the whole data set that we have, bring in from different um, processes like doing FGDs, like doing one-on-one interviews, different CA activities, bring it all together. But then there was again realization that this data is not still speaking the whole story. And then our CA team thought of doing another activity, which some of you might have heard of it, which is called photo voices, because we wanted to really understand from the community members what it actually means. I mean, is there a layering beyond that livelihood aspect, that whether people do actually see some harm in burning plastic, or they understand the ill effects of burning plastic? And they were asked to simply, volunteers were asked to simply click photos of the waste in their community. And then there was a gathering happened where those photos were put together on the screen, and then the person who has clicked was asked that what made you click this picture. And while people were telling those stories, then everyone realized that it is a source of livelihood, but at the same time people do see that there are ill effects of burning plastic. There are families who have faced those ill effects, and it is not that it's their priority to burn plastic, but there are reasons because of which they end up doing that. If they don't have any alternate to livelihood, they end up choosing it as a livelihood for them, knowing that it is affecting their health, their children's health. And then eventually we moved to a co-creation phase, which is the next phase of this study, where we started doing co-production workshops, and we brought all these stakeholders together in under one roof and started having this discussion, that based on our understanding, we think there is this long list of interventions we think we can do. For example, like having a waste bank or a collection center within the community, which was shown as part of the video, which will not let people go away from the livelihood part, because they can still collect waste and give it to the waste bank, and they will give some money in return. And so on and so forth. This was discussed, and a co-created intervention package took shape. So currently we are in the pilot phase, and very important aspect of the work, which again was given to us, is in terms of how we are evaluating this process. So we are following this framework from the Medical Research Council, which helps us to look at this aspect of the work that we are doing from different sort of lenses, that how effective we have been in doing meaningful community engagement work that is happening within the community. Like, if I give you some more sense into it, Deepika, do we have time? Can I take a couple of minutes to explain this more?
Okay, yeah, but we are running a little delayed. I think,
So just give me a minute. I'll just quickly wrap this up. So
sure.
we, in terms of evaluation, if I give you more insights, we try to go back to the same set of participants who were part of these co-production workshops, to ask them how they have felt in terms of trust, power, and mutually beneficial relationship, how relevant they thought that this work is for them, how their capacities were built during the process, and how capacitated they felt. And then do they think if the inclusion of local knowledge and was done as part of the process, and also what are the perceptions that they hold in their mind of the process and the output that is coming out of this work. So in a nutshell, this is the crux of the video that you have seen. Now, without taking any more time, I think I will still invite people, if they have any reflections, any thoughts, to put them in the chat. But I will like to invite Dr. Sinethimba, who has been contributing from the beginning, to give share some reflections from the African context. As some of you might know, that Dr. Sinethimba has her education in nursing and is currently working as a postdoctoral research with Professor Marvis. So over to you, Sinethimba, if you can bring in more reflections from African context.
Thank you so much for this opportunity. In a South African context, we are experiencing various challenges ranging from access to healthcare for people who are residing in rural areas and informal settlements, and more effort has been made to bridge the access to healthcare services, including mobile clinics and digital services. However, majority of our communities, they remain in living in poverty and also facing such challenges of being marginalized in terms of practicing their indigenous practice, more especially in addressing healthcare matters. There is a Traditional Healthcare Practice Act of 22 of 2007 that is established to assist in trying to converge or trying to merge the two streams of Western or biomedical medicine and our indigenous health. And that is where most of the community engagement is coming from, where we are trying to ensure inclusivity in policy development, in improving access to healthcare and empowering these communities to function effectively in terms of disease prevention, job creation, and transforming their lives. So in definition of community, our community is defined in a historical way. If you can reflect, South Africa is post-apartheid era, and most of it resulted in still we are trying to shift from the effect or the impact that formerly disadvantaged communities suffered. And it also poses a lot of challenge to healthcare access and emancipation from the communities through health promotion. And apologies for that. But however, at the moment, we have post-apartheid, of course, in the democratic area, where people are defining communities in different ways. For some, they refer to community as a neighborhood of people who are sharing a space, or people who are sharing same cultural norms, religious and linguistic affiliations, such as we have different cultures. There's Zulus, there is Christian groups, and which are also identifying themselves as communities. And so for communities engagement, we mostly rely on activities that are emerging from research activities, as they have obtained ethical clearance from departmental or from ethics committees of various institutions. This is to ensure that the communities are not exploited, they are protected, and their benefits are being looked out for in terms of community engagement, that people do not conduct research to exploit them or in financial benefits and they do not get anything. Some of the things we have discussed, I don't want to repeat, but I just want to share a case study that we have done here in the Ubuntu project under the leadership of Professor Mavis Mlaudzi. Just for people who do not know, I'm going to give a background of our community model. Oh, my apologies. I thought I will show my face. Is it still fine? Okay. Let me see. Oh, okay. I really apologize for that. So in the Ubuntu community model, it is led by the research chair, Professor Mavis Mlaudzi. It's a 5-year renewable project, which is aimed at improving universal access to healthcare and health outcomes for people living in remote, rural, and under-resourced areas or communities by developing, piloting and implementing Ubuntu innovation model approach and principles for co-production and convergence of indigenous and biomedical knowledge. So the project is deeply rooted in values and principles of Ubuntu, which also led to its collaboration with various universities and communities to ensure that we try and improve this access to healthcare. So one case study I'm going to share, we utilize participatory action research as an approach, and we followed its cyclical nature. And I'm just going to briefly share how we went around in applying the cycles of PAR, which is participatory action research, to engage with the certain community. So the first phase of PAR is assessment and negotiation of entry. So we used this phase to go and engage, introduce ourselves, and we went through the gatekeepers of the community. The village that we used was in one of the provinces of South Africa. It was in Venda, and they still very traditional. So when you want to come to their area, you must first start with the traditional council, and they call a meeting, and in that meeting, then that is where they will hear your side and also see if they receive you. And also that depends on the approach that you use. You must be respectful, and you must come in a manner that you acknowledge them. You don't come as someone who is overpowering them. I think it's also part of the power dynamics. You are avoiding to make them feel threatened in their own space. And through that engagement, we had an open, informal discussion, trying to find out the challenges that they are experiencing. And what came up was the problem of moral degeneration amongst the youth of that community, where when looking in South Africa as a whole, it was not only that community, but it's a challenge that we are facing country or nationwide. So what the community wanted to do, but without a power, they told us, they informed us, because now when we engage with them at the level of PAR, they become co-researchers, they become co-investigators, and they lead. They gave us an idea that no, we as a community, we want to do something to regenerate a moral campus of our youth. And from then, we then discussed and find out how are we going to do this. Then that led us to the planning phase of participatory action research, where we sat down and I'm just going to mention that the people that were involved, it was the teachers in that first meeting. It was the teachers, the parents, the tribal council, and the school governing body, and the teenagers themselves were also part of the session. And what came up was the need to have a boot camp that we take teenagers from various schools in that area, and we empower them with values and principles of Ubuntu in a way of trying to regenerate their moral campus. We also added issues of sexuality, reproductive health, and SDG, and to align our work with it. And when we were done with the planning phase of the boot camps, we then moved to the next part of the phase of PAR, which is implementation. We actually had the boot camps. So the boot camps were 3 days. They happened over a weekend. and we engaged with the teenagers, with the stakeholders, and there was a lot of knowledge exchange. And you could see that when a community is given a power or supplied with the support and resource, they are able to show their effort and to show and drive the research activities that will lead to transformation of their lives. As a result of that, we ended up having ambassadors of Ubuntu that came up from the teenagers themselves, and they also shared how they are going to use Ubuntu as a reference to going forward, showing that they have gained something, that their morality has been regenerated, and how they are going to change transform their environment where they are staying, as they also indicated that food security was one issue that was contributing to their challenges, and they were able to be supplied with seeds and a space to do gardening. And also one of the universities offered agricultural science, and the teachers there also assisted in starting community gardens and school gardens, which were very helpful for the community. After all that has been done and happened, we went on to the next phase of participatory action research, where we had a reflection session with the community and the stakeholders that were involved, and also on that reflection, it came up the different things that the experience of participating in this engagement. It also brought about what future interventions or future needs that they have. Is my time up?
Sorry, Senator Themba, are you able to round up in 2 minutes, just because we would like to open the floor for reflections and round up. So maybe just 2 minutes more, please.
Okay, thank you so much. In summing up and wrapping up, I think I will just say that with the experience that we had with engaging with this community particularly, we learned that when researchers become facilitators, the meaningfulness of engagement comes up, because we are not imposing our interventions, we are not imposing our thoughts that we think these people are supposed to do this, and this is how they are supposed to view their challenges and their abilities. And we learn from each other through the partnership and through using the respect and listening skill. We are able to give them a sense of ownership and a sense of belonging through the engagement. Thank you. I think I have tried.
Oh, you did a great job, Senator Themba. Thank you so much. Sorry, we've run a bit out of time. We would like to get, the summary from you and perhaps share so that people can read more in depth. But we would like to open the floor and get a bit of discussion going before we close. Deepika, I was wondering, maybe we will want to bring up a Mentimeter at this point and just begin to get a bit of thoughts, what people still think around, what are you really getting from this? What are you hearing from everything that is said? Is it helpful? Do you still envisage that you will have challenges? And so maybe we'll just get, if anybody wants to share a quick reflection, please feel free to raise up your hand and we'll give you the floor. And maybe you want to reflect on anything Senator Themba has said or Maruf has shared. But if we can just have the first question, Deepika. We will go to the Mentimeter, and I think the thing we're keen on hearing really, it's what are you hearing? What are you getting from everything that has been said today, and whether you find this helpful? So the first question.
Just navigating. Give me a minute.
Yep.
Yeah. Going to the same Mentimeter. I hope you've not closed it. But what is one new thing you learned today that will help you conduct CEI meaningfully?
I think I can quickly share that. I think, Maruf, I liked your invitation to be specific in who we look at as community. And I know I struggled a bit with the definition when you mentioned people who are affected by our research. But when I thought a bit more about your definition, I began to ask myself the question about whether I'm being specific about who the direct beneficiaries or the direct targets of my research is. And the other thing I took from your definition is that the people who are directly affected by my research exist in community, exist in a relationship, share a sense of connection. So it's not an individual. The other thing I took from that is that even within communities, there is power hierarchy, and I like what Steve mentioned there, and competition of interests. And community engagement is probably not as straightforward. But I wonder what other people have taken from the reflections today. What is one thing that you got from all of this? If there are things on the case study that has been shared, Senator shared as well, Maruf shared as well. Okay, I see. I often will struggle with the word community empowerment because it makes me feel as if as a researcher, I'm the one giving power to the community. And Senator, I like the word you mentioned when you said researchers as facilitators, in helping the community define something or find the words to express what they already know to be a problem and finding the solutions. And so, yeah, project ownership I think, is that role that I will want to play as a researcher. I was responding to Rivka's comments in the chat where she was like, how can we really do community involvement when the agenda for the research has been set by the funder? And I feel like my role as a researcher is to help the community take ownership of the direction, of the research. It's not straightforward. Did anybody want to, speak a bit to that? Do you want to type in the chat and say, that's the one thing you learned today, that it's not straightforward? Absolutely, I agree that it's not straightforward. And I think, Maruf, you had pointed that, and Anshuman mentioned that around how often the engagement is going in a very cyclical order, back and forth, back and forth. And let's go to the next question, if we may, around. I'm really keen on hearing what people think are still challenges. I mean, Senator mentioned a lot about, foregrounding community protocol, community heads, community authority, recognizing that. Maruf mentioned a lot around taking time to build trust. Maruf, I like what you talked about, spending time to build trust and some of the photo voice activities you use to bring through community voices. But what do people still see as a challenge? What do you still envisage? Building trust. Okay. All right. Okay. Okay. I mean, see, Rivka, you made a very interesting comment when you said, you're engaging with a community leader, but yet the people in the community don't even know such a person as a leader. So is that the right person that I'm talking to? Please, Maruf, go ahead.
Just quickly want to add, I mean, the question that Rivka was asking, I think it is also very important for us to also educate our funders as well, that how important it is to have this approach, because I completely agree that a lot of these funders, they might not agree to this approach, and if they agree, they tend to stick to the deliverables, the timelines, which they're mostly interested in. But that sort of flexibility is very important for doing this kind of work, to have that pragmatic approach built into your work. And for that, we have to sometimes do some bit of education for our funders, which is again not a very straightforward thing to do, but in some strategic way, it is very, very important.
No, thanks, Maruf. I was just reflecting on one of the points made here, incentives. And I know that a few of our colleagues from the SMRC are here. We're doing a few seed-funded projects together, and we realized that, see, we had a lot that we had thought will go into the research project itself, but then, we don't have enough incentives for community, engagement and involvement, and community members need to be supported to take ownership of their research. So that's a key challenge. Not reinforcing hierarchy, absolutely. And perhaps one way to do this, if you agree, is really taking time to understand the power dynamics so that we are not going to reinforce something that is inequitable. Okay. But if I may invite you, Senator Mbo, if you're still online, to just share a quick reflection before we move to the next, to our last question and wrap it up. Can you briefly just speak to how you have found the right person? I'm trying to shy away from calling people stakeholders, but how have you found the right people of interest so that you're not reinforcing a hierarchy? Senator Mbo, are you still available to share your thoughts?
Yes, I'm still here. And
Sure.
if I understand the question, is how have we found like a stable community that we engage with?
Yeah, just finding the right, maybe authority, finding the right people of interest to engage with.
Oh, okay. So I think if you remember, our project is having different subunits in it. And we're having 5 subunits at the moment. It is mental health, it is community engagement or activities, it is sexual health and reproductive, it is traditional health practice, it is I forgot the other one, but we have students that are under each and every subunit, and they are having top titles, research titles that they are pursuing under each of these subunits. And I think that is very helpful because they come at the very, very important level of approaching the community itself. And then we also have communities that we have adopted under the project. So, like, for instance, here in Pretoria, we have 2 communities that we have adopted, and every time we want to engage with them, we are contacting them. We have a contact person within those communities. I'm not sure if it answers
No,
the
thank
question.
you so much. Yeah, a lot of this is over time. The relationships we've built over time is what I'm hearing from you. Okay, so we'll put up the last question around, what's your interest will be in, a subsequent workshop to take this a bit deeper, because I think what we have done is gone through very quickly. And maybe in the chat, just type in what exactly, if there was a part 2 of this workshop, what would you like it to focus on? Maybe you can type that in the chat. But I see, Glory, you've got your hands up. You have some reflections to share while we...
Yes, I think I wanted to respond to the question that you asked in terms of the challenges that we are encountering when we are executing community engagement activities. So I just wanted to find out to say, for me, I would say the challenge is to work in a community where community members are not in good terms, to such an extent that the chief is not listened to. Remember, the chief in local communities is the head of the community. So for me, I think there's a need for a conflict resolution workshop to take place. So I'm asking suggestion here to say who must lead in this conflict resolution workshop.
That's quite an interesting question. We're the research project now becomes not just about data collection to answer a research question, but helping to bring community members together, because without community members being together, you can't even have a research project. But let me invite Maruf and Senetemba very quickly. Has there been an opportunity where you had to deviate from the research plan to bring community together to heal conflict so that they can work together on a research? And what did you do in that instance?
So
No, I
Yakubu,
never had the. Are you
sorry,
asking
go on.
somebody else or I?
No, I'm asking Maruf to sort of respond to your question.
Okay, thank you.
Yeah.
So Yakubu, there are many instances of such sort, but one that piqued my mind while you were asking this question is there is one site as part of the part of our center in India, and since it's a quasi-experimental method that we have been using, so we have 2 areas selected as intervention sites and 2 areas as control. And at some point of time, while we were already done with our formative phase, we had already done the analysis and we had the report ready. In one of the meetings with district administration, we were told by topmost official at district level that can you switch between the control and intervention areas, because the area that you have picked as control is actually the aspirational area for us, and that's why we want you to also focus in it in your intervention, so we can also see some changes happening in that area in terms of the work that is coming out of your research. I mean, it was a very difficult position for us because we had already done the formative phase, and no one would wanted to go back almost 1.5 years of work and then do it. But if you would say no, you might end up placing yourself in a position where you might lose complete buy-in from the government or district administration side, and they all are very key stakeholders. So we sort of tried to figure out what are our pros and cons will be out of this, but eventually we agreed to them and made some changes, and thankfully we had the flexibility from the funder side that they were not very pertinent to the fact that you cannot make changes. In fact, they have always invited us to, this is one of the good things that I would say, that they've always invited us to make changes in our plans, but at the same time they have said that those changes should be result of the CEI activities you are doing, not because you think as a researcher or a research team or as an expert that this change should happen. This should be the result of the community engagement that you're doing.
No, that's helpful. I think that more and more what I am saying that research should do is actually make it easy for community members to speak to themselves. And where there's a crisis in the community where, people cannot speak to each other and even come together to define the problem, that's quite a huge challenge, and maybe not within the remit of what a research project can address. But what I will be doing in that instance is asking if there are leaders or people that they respect who they will want to invite to listen to. And what that means to me is that it cannot be all about my research at that stage. It might be I'll have to account for how long it will take for that process. It might be that I'd like to encourage them to look within, to see revered people, that they will want to invite to encourage a bit of that community healing. It might be like Maruf, you've mentioned, there may be a need to tweak the research focus. It might even be that is not the right time for research, that I might have to pause research so that community healing can occur, and come back to that. But Gloria, I don't think there's a straightforward answer to that, and that's a conversation we're happy to keep on having with you. We're almost at time. We've asked people, if you will be interested in a part 2 of this, So if you can, just still type in the chat what exactly you would like us to focus on. But as we wrap up, I just want to mention something I've really had from listening to both Maruf and Senethemba, that the people we do research for and with, we need to clearly define, who benefits from our research, or who is influenced by research, or who is affected by research. So whether the beneficiaries, whether the people who are impacted by it or influenced by it, they exist, they can exist in community, and those communities can exist within hierarchies. And so really meaningful community engagement is really about how do we make this a meaningful experience? And I think the issue around equity, really, how am I not reinforcing inequitable patterns that promote disease and illness, really comes into play. And Senethemba, I really like how you took us through that process of defining how we're even entering the community, recognizing what the cultural protocols are, and taking and working with the community through defining their own problems and finding their own solutions. And what you said around, helping them, serving as facilitators so that they can, address their issues, and finding resources so that they can do that. No, this has really been helpful. And if you're interested in putting down this as commentaries, together, we're really particularly interested in capturing what CEI looks like in an African context. So we'll drop an email there. There's a lot of wisdom that you can still share with us. Please do reach out. But we would just really want to thank you for spending time with us. We really once again want to thank our partners at the SMRC and our partners from the Northwest University, and of course our partners from University of Pretoria, for your support in making this happen. And of course, I can't thank you enough, Maruf, for your patience and for sharing your wisdom with us. And thank you, Deepika, for this session. But please do reach out. Our emails are here. Maruf's email here is there as well. And have a nice rest of your day. And thank you so much for spending the time with us. All right. Have a good one.
Thanks. Bye, everyone.
Thank you. Thank you, everyone. Bye-bye.
Thank you. Bye-bye.
Bye.